monument, the Mysore Palace. My philosophy is very simple. Seeing the same thing from a different angle is happiness. The same Mysore Palace, when seen from in the evenings on festival days, holidays, and special occasions, looks gorgeous. This is my philosophy. Be happy, try to make others happy, as well as look into the good things in everything, other people, nature, everything. I've been introduced by my good friend that I am the Professor HOD of Anatomy, JSS Medical College, recently starting a college in Mauritius. He was also the ex-dean of Faculty of Biomedical Sciences in Mysore. It is me. This is one of the very prestigious medical colleges, one of the top medical colleges in India. I'm proud to be associated with that. I've been associated with this more than 40 years. This is the Anatomy Museum. I call it as a spare parts of the human body. We need to know what are the different organs, different parts present in our body, so that we can keep our health perfectly in a good condition. In fact, almost every week or 10 days, a group of high school and college students, as well as the public and visitors to Mysore, come to the museum because it's a very large museum, hundreds of different specimens. As you can see there, more than 10 rows of double rows with different organs. Some of the diseased organs, including cancers, have been displayed. People are always interested to know something about their health because I believe health is wealth. Incidentally, I'm also a family physician doing general practice. 45 years back, I had the privilege of having a higher training and specialization in pediatric surgery or children's surgery. Incidentally, to keep myself in a good happiness, I have many hobbies. I'll try to let you know about them a little at the end. All of us would like to be happy like these children, innocent children. When we grow up, we always say we should have been children, but when we were kids, we would like to grow up and do a lot of things. All the different types of children, different probably countries, different ethnic groups, they're all happy. Yes. In the evenings, instead of chit-chatting with some people or wasting time on mobile or internets, I thought, let me utilize my free time, maybe 6 to 9 o'clock, doing some social service. I started a small clinic in Siddharthanagar, Mysore, 41 years back. And most of my patients, maybe more than 90% of patients, are poor villagers who cannot afford to go to any private hospital. 40 years back, 10 rupees was quite a big money, I should say. People saying 10 rupees, oh. When I started, of course, it includes the medicines, tablets, injections also. Being a surgeon, I've been doing surgery since 40 plus years. In my clinic itself, I've done more than 3,000 surgeries under local anesthesia. That means giving an injection, making that area numb, and operating. So people are happy. More than that, I'm happy about them. So some social service to have personal satisfaction, because money is not the thing for happiness or satisfaction. As you can see there, most of them are low and middle class or lower class people. In fact, I always say people come in cars and high-end people I do not want because they have got their own way of approach to life and they want specialized big corporate hospital on that. So in that way, I'm very happy that I've been able to be of some help to the general public, particularly villages. Little bigger surgeries, I have a few students of mine nearby. I go to their hospital, to their operation theaters. I do the surgery. Fortunately, maybe they have considered me as a good teacher also. So they say, sir, don't worry about the money, sir. Whatever your patient can afford, even minimum also doesn't matter, sir. The fact that you have come to our hospital to do surgery, that to whatever we are today is because of your teaching. There's a gratitude. So they say whatever patient can afford, both in my clinic as well as in the major operation theater, my charges are zero. I do not take any money for myself. Whatever materials I use or whatever other expenditure involved in surgery, only that minimum I charge. Some of them are so poor, I tell them, don't worry, next I will take it. I feel more happy than the patient and relatives. For example, children are born like this. To me, it's a very simple problem. There's a collection of watery fluid inside the scrotum, what we call, in a male baby, outside the testes. For the parents and relatives, they think is something gone wrong very seriously. Is there since birth. They're panicked. They go around the different hospitals, specialists, and all that. And with due respect to them, they're all scared because their baby has to be admitted and operation has to be done. Is it a tumor? Is it a cancer? All that. Finally, somebody suggests, no, don't go to hospital. They charge thousands and thousands. Go to Shama Sundar. He is the key person in these minor surgeries. Maybe half a dozen rounds in different hospitals. They finally come to me. I tell them this is a very simple problem. There's a water collected. It hardly takes 2 to 3 minutes, not 2 to 3 hours, 2 to 3 minutes. The child is not given anesthesia, general anesthesia. The small child, even at birth itself, I've operated. So my assistant tries to keep the baby in a good condition, maybe giving a little milk or trying to pacify that. I give local anesthesia to the area where I'm operating. The baby doesn't even have the pain. Then in about 2 or 2.5 minutes, the surgery is over, repair is over, and the parents are handed over with this baby. They're really surprised. Such a simple problem, sir, and a lot of confusion, lot of tensions. I said, fine, it's over. So like this, I get a lot of patients. All these, see this is a birth defect, what we call manufacturing defect, to put it in a lighter sense. 2 fingers have joined since birth or before birth. It's a very minor operation. Give local anesthesia to the 2 fingers, separate them, stitch them. The maybe adult also. Patient is happy. I'm also happy. Minimum charges because hardly any expenditure from our side. So I am trying to show all these things. You being teachers or general public might come across such situations. People are afraid, to be very frank, people are afraid to go to hospital. They're afraid to go to the doctors because they may say it's something complicated. They're afraid to listen to them. So some more, as long as it's not causing any problem, they postpone this. But one fine day, they realize that it's not worth dealing too much. So they go to hospital. And many of them luckily come to me saying that it seems you do surgery and very low cost. So I tell them there's a problem. Absolutely nothing to worry. It will be 100% corrected. So being gentlemen and ladies, when you come across such a situation, explain to them there's nothing serious. All diseases, almost always, most of the time, are curable. Particularly, I stress when identified in the earlier stages, including cancer. I show you some of the cancer photos which have operated. Even after 30 years, 40 years, they are alive. More than they being happy, I'm happy to see them. After 30 years of cancer, still they are alive and they are happy. So early diagnosis or early identification of the disease, then treatment definitely corrects the whole problem. See, the baby looks almost all right. As you can see the arrow there, the right side of the mouth is a little longer since birth, before birth. It's a very simple cosmetic surgery or plastic surgery, what we call. We make the measurements on the right side and left side, make markings, how much of that extra this thing has to be stitched. Under local anesthesia itself, it can be done. And edges are stitched. It's very fine sutures or stitches. Is not even visible. Is a small boy. So after some years, even that stitch mark also disappears. So to the general public, it looks very complex, but when it is actually the fact, it's a very simple problem. These are little more complex things, but curable. Right at the time of birth, the small baby had a head maybe bigger than mine or yours, very huge. There was a collection of watery fluid, what we call a cerebrospinal fluid, which is present inside the brain and outside the brain. There was some problem, block somewhere. So this is known as the hydrocephalus. Hydro means water. So as soon as the baby is born, we examine the baby top to toe, assess the condition of the baby. If any treatment to be given is given, then explain to the parents that brain is going to be compressed with excessive amount of cerebrospinal fluid. It has to be corrected. But if there is no other complication, all the other organ systems are good, the baby is going to completely survive, is going to live normally till old age. So we are going to drain that extra fluid by putting a pipe into the abdomen, and gradually the head size decreases, brain also develops normally. There are babies with some swelling in the lower back, all these, there are hundreds of them. So we do make a diagnosis. Luckily nowadays we have good simple investigation like an ultrasound or X-ray. We can find out what are the different types of problems available, and most of them are correctable. See this, to you it looks like a wonderful baby, wonderful girl. But having known the problem, I feel really very sad. The girl has a condition or disease known as Down's syndrome. Normally our cells have got a chromosomes, which are like software, DNAs. 46 of them. This particular girl has got 47. So even extra is dangerous. There is a unfortunate part. Each chromosome is numbered. 21st chromosome, instead of being a pair, every chromosome is a pair, has got triplets. Instead of two, it has got three. Just because of one extra chromosome, the whole body has been altered. The brain, particularly nervous system, has been affected. Development of the brain has been affected. At the age of 2.5 years, the children talk so much. They can tell their name, they can identify people, they can eat the food, they can even have a bath and things like that. But this unfortunate girl, because of the IQ and brain subnormal development, even after the age of 10 years, it cannot talk, it cannot brush the teeth, it cannot put on the dress. Heart problems can be there, eye problem can be there, hearing problem will be there, skeletal muscles, very unfortunate. You always think one extra is always advantageous. Yes, maybe some situation, but extra chromosomes caused a havoc here. Of course, we cannot remove the extra chromosome from millions and millions of cells. Only thing that we do is train not only the child, train the parents. The child has to be trained. Gradually, the brain development increases, even though it is slow. The child, Down syndrome child, starts learning. It can go to school, but may not be the regular school. It likes music. It likes dances. So it is physically and mentally encouraged by repeated actions. And definitely there's improvement, but definitely slow. So every disease has got a treatment. This was almost 43 or 44 years back. Beautiful twins. Exactly 5 to 6 minutes before the delivery of the baby, both the babies died inside the uterus. Very, very unfortunate. Otherwise, quite well grown, good, beautiful, healthy. So immediately they had to do the cesarean operation. and take over the babies. They try to revive, they try to do all types of resuscitation measures, but unfortunately, they could not revive the baby. Suddenly, we do not know what happened. So suddenly there was a block in the blood supply or whatever. So the hospital and my own teacher was working there. Said, please give it to Shama Sundar. Let him keep in the museum so that people will be educated to be aware of such abnormalities and catastrophes. So even today, this baby, after 43 years, still there in our museum. So now, after a small introduction, how important is the health? You can have crows together. I don't think you'll be happy. If that was so, all our politicians and business people, the film people would have been the happiest. Unfortunately, they are the most unhappy people. Assets, cars, bungalows, whatnot, none of them. According to me, health is the most important thing. If you have health, you have everything. Any amount of money cannot give you health, cannot give you a cure of some diseases. So I thought most of you are very enthusiastic youngsters and you've got a very high responsibility as a youth towards the society with maybe students, general public, your own family members and friends. Some basic knowledge about health is going to help you in making the whole society a healthy one. As I told you, money is not happiness, bungalow, cars, nothing is happiness. Good health is the happiness. Most of the middle class people, most of the cool going people, happy people, people with a lot of satisfaction, no craze and things like that are the happiest people. After all, what we need, a good breakfast in the morning and a couple of food in the afternoon and night. Maybe a little extra for day-to-day affairs. But we are greedy, we are selfish, we spoil our happiness and health also. Most of the time, we don't need to blame others. The health is in your own hands. Little awareness about day-to-day activities, what is to be done, what is not to be done. If you understand, you can always be healthy. At one time, we used to say you got a family history of diabetes, sugar problem. Your parents and grandparents have got high blood pressure, hypertension, or your parents are obese, some family history of cancer. So there's a possibility of you getting it. But other story is almost gone. We have been seeing parents, grandparents, everybody is perfectly all right. An youngster, 20s, 25, 30s, having hypertension, having diabetes, having cancers. So family history and all that is going away. Maybe our own lifestyle, our own food habits are the ones. So if you can understand yourself, you have understood life. As simple as that. So let's go around the whole body in about 35 to 40 minutes. Already I spent about 15 to 20 minutes looking into different organs, what they do, what common diseases that particular organ may get, and how to be preventive, because prevention is better than cure. It's cheaper, faster, safer than getting a disease and getting cured. My philosophy is the most important thing. Very, very high positive attitude. Even the Gita says, whatever happened yesterday is for good. Whatever is happening today is also for good. What is going to happen tomorrow is also for good. Have a positive attitude. Spread this positive attitude among everybody, including people who have some problems. Don't worry, things will be all right. Somebody's moral support itself is going to change their life. Probably all of us have seen this. For this, you have to have self-confidence. You should be bold enough. Say, I can do it. Nothing is impossible in this world. Everything can be done. So that's the philosophy. I always teach my students, of course, even the friends, try to dream big, not a small dream. Try to dream. I should get a first rank to the university, to the board. I should be the topper in my class. I should score 100 out of 100. When that attitude comes, naturally the whole system, or body, or mind, everything works to achieve that. So you have to plan it, that's all. People do it, yes. So as I told you, health is wealth. The most important thing that nowadays we are coming across, other than the food habits, other than lifestyle, is a stress. Stress is going to be there. It's never going to go till we are alive. But we have to understand stress is a thing which can be avoided, which can be controlled. That's what is. Haunting on that, oh, I got this problem. That problem is not going to solve the problem at all. Try to find out why you got the stress. Many times I give examples of students. Throughout the year, they don't study. 1 week before examination, they become panicky. They try to open the books and they are confused and they are in tension whether they're going to pass or not. Maybe an interview are not prepared well, tension in the interview, everything. So plan a little. Stress should not be there. More than anything, stress appears to be the most important thing for so many diseases. Stress is a commonest point nowadays we are seeing because it brings in a lot of psychological, mental stress, which indirectly produces physical and other stresses. So try to avoid stress, try to overcome stress, say that I'm bored, I can manage, I can do de-stressing, nothing is going to happen because stress can lead to high blood pressure, stress can lead to diabetes, stress leads to depression, inactivity, overweight, obesity, and most unfortunate thing is a long-term stress also can lead to cancer. So that's why I put it in red. You don't need to have stress at all. You can be cool. Okay, let it come. I'll manage. Be bold. Have self-confidence. Let us see some of the important organs. Why I have put heart in the one? Number one is every organ has got its own importance. But why I have put heart is there is a only organ which provides oxygen, nutrients to every part of the body. 24 hours a day without a break. We may sleep, we may take a break, but heart never takes a break. And you'll be surprised, heart does not start pumping the blood at the time of birth. It has started almost 8 months earlier. When the baby, what we call as embryo, first 2 months is called embryo, 1 month old, already a small heart, or the size of a small ragi seed, that is the size of a heart in 1 month. It has already started contracting and beating. In about 3 to 4 months, heart is fully developed. Of course, it's small, gradually increases in size. Till the last second of our life, heart starts pumping 24 hours a day. It never takes rest. That's the interesting thing. The heart does not pump blood, which contains oxygen, nutrients. The waste material from different parts of the body has to be brought back to heart to be cleaned by kidneys or cleaned by lungs. So it has to work 24 hours a day. If it fails or stops, oxygen is not supplied, nutrients are not there, the person dies. Every cell in the body dies, starting from brain. So that's why I kept the heart as the most important organ. It has to work. Take care of the heart. Heart will take care of you, as simple as this. In fact, you'll be surprised. Most of the organs in our body have been designed to work for minimum of, I repeat the word, minimum of 100 years. Unfortunately, what we have done is we have spoiled it physically, mentally, due to food habits, due to infections, due to stresses. People have been dying of heart attacks at 20s, 30s. We see in the media and the papers. All this is due to different lifestyles and food habits and stresses. So keep yourself cool. You're not going to die next minute. Try to understand the problem, try to manage it. Heart is a wonderful pump. It tries to manage itself. Small little problems, it will correct itself. Only when the blood supply to the heart itself is compromised because of a clot, because of the high blood pressure, because of the diabetes where chemical changes have occurred. virus infections, bacterial infections. Then the small artery, what we call as the coronary artery, decreases the blood supply to the heart. So heart itself is not able to work. How can it pump the blood to all the parts of the body? So that's what we say, cardiac failure, inability to pump sufficient amount of oxygen and nutrients and blood, or heart attack. Routinely we hear this, where the heart has stopped. Heart has completely stopped. When the heart stops, the blood supply is not there, brain automatically stops. All the organs gradually, depending upon their activity, over a period of minutes, hours, or then they die. So take care of the heart. Yeah, this is the real heart. A new technique called plastination designed this. Real heart, one can carry in the pocket. There's no smell. Totally, when you saw my museum, you found some bottles, glass and plastic bottles. Inside there, there's a transparent, clear liquid called formalin, quite irritating smell. So, new technique I had designed, luckily for me, and the second person in the world and first in the India to design this technique of plastination. Plastination is nothing but using polymers and plastics, preserving the specimen. Any part of the body, whole body, babies, everything can be preserved. Brought a few specimens, I'll show you at the end. There's no smell, there's no bottle, I can keep it outside. In fact, I take it in my pocket to the class, give it to the students so that they can have that touch and feel experience. So I give these to the patients, different types of disease, including disease organs, tumors, cancers, all have been plastinated. So people are very clear, oh, this is what it is. So in that way, there's a heart from a dead person in our anatomy dissection. Probably next in the list would be the nervous system. There is a supercomputer, more than the supercomputer, which gets information from every part of the body, every millimeter of the body, regarding what's happening outside, what's happening inside. Environment, external environment, internal environment. Is it cold outside? Is it hot outside? Is there any sound? Is there any light? All this information. A small ant crawling on your fingers, something pricking you, causing pain, pressure. 24 hours a day, the nervous system, which is composed of brain, spinal cord, and hundreds of nerves are in activity 24 hours. They get information what's happening outside the body and inside the body. They analyze, they store information, they discuss, finally come out with a output of what is to be done to the muscles, output to different glands which secrete some juices. For example, in the mouth we have a saliva, in the stomach we have got a gastric juice, bile is produced in the liver, intestine produces intestine juice, skin also produces sweat and oil secretions. So all this is controlled 24 hours a day. Some of them automatically also, how the heart has to beat faster when you are doing exercise, running, sports, doing a dance, how the heart rate has to come down when you are relaxed or sleeping. All that is done automatically. Changes in the respiration, rate of respiration, everything is done. So, supercomputer, wonderful supercomputer, which keeps a track of all the organs. It coordinates all the different functions. There is the brain. Brain is about 1.25 to 1.5 kgs in weight, wonderfully kept inside the brain box here. There is a skull, very well protected, much stronger than the helmet that we use, but still a very costly accident can fracture the skull, damage this brain. One very unfortunate thing about the brain is every cell in our body can repair. Skin is damaged, new cells of the skin develop, it is repaired. Bone is fractured or damaged, new bone cells are formed, it can repair. Muscle is repaired. Every organ in our body has the capacity to produce new cells of its own kind and repair it. But we do not know why nature, God, has taken away that property of repair to the brain. Once a neuron, what we call as the brain cell, dies, that's the end of it. It will never regenerate. A second very interesting information probably you'll be surprised is when you look into this, it looks like a ragi ball or a pound of cake or something. It's not at all so hard. You'll be surprised that you have the butter, hold the butter in your hand, within seconds it becomes collapsed. So brain is very, very soft like butter, maybe a little thick curds also. So such a delicate brain is surrounded by cerebrospinal fluid, providing a water bed. Around this, there are coverings called meninges or coverings. Around that, there is a skull. So very well protected. Unfortunately, what we see every day in our city is particularly youngsters. They do not want to wear helmet. They go at high speeds, sometimes carelessly also, in spite of whatever media, police telling. Unfortunately, they meet with accident, and we have heard the news. The person died on the spot due to head injury. So whatever you may say, the attitude still continues because brain is such a delicate organ. When there's a fracture or a severe hit, the brain permanently once for all dies. Nothing can be done. We do not have any possibility of brain replacement. Heart can be replaced, kidney can be replaced. As on today, we are unable to replace the brain, even though some research work is going on, wherein stem cells are being injected to some specific diseases. So those stem cells, basic cells, develop into neurons and they repair. But still a lot of research is necessary in this field. See, these are your human brain. Wonderful area, lot of memories, more than 100 years. It can store all types of information. Fraction of a second, it can come out. Our laptops, computers take a few seconds to start or open up a file. Whereas our brain is more than supercomputer. You think of your class and whatever you're listening to me. Next fraction of a second, you think of your family members. Third second, you think of your movie. Everything switches on and off within fraction of a second. There's the beauty of trillions of neurons, crores together of neurons, storage, information, analysis, discussions. To study this very dreaded disease, unfortunately increasing throughout the world, depression, khimnate. We in JSS Medical College, a group of doctors and scientists, including the PhD students, started a depression brain bank. This is second in the world. One is in Netherlands. We collected the brains from people who died of depression, who committed suicide due to depression, with kind permission from the family members and taking care of all the legal issues. We collected about 54 brains. These are very special refrigerators where the temperature goes below -80, below zero, -80, where the brain can be kept for hundreds of years. No change occurs. Of course, we did not keep it for hundreds of years. Couple of years, we did a lot of studies on these brains of depression people. Different sections, microscopic studies, MRIs. Nobody had done MRI of a dead brain of depression. We looked into DNAs, we looked into neurotransmitter, chemistry of brain, so many. Incidentally, this was the first such a deep study. It was published in very high impact factor journals, and we got the, in fact, I got the gold medal also at the national level, and we got a lot of international support for this depression brain bank. Second probably is our oxygen, lungs. See the unfortunate thing, at the time of birth, whatever lungs you are seeing is so beautiful, looks like a sponge. 24 hours a day, along with the heart and brain and other organs. Is taking the air, giving the oxygen to the blood, taking away the carbon dioxide that's been there from different regions of the body, put it back into the air during respiration, inspiration, exchange of oxygen and carbon dioxide, and expiration. See the right side. Because of air pollution, most unfortunate thing is people pay money to get the disease. I think you understood. Cigarette smoking, BD, cigarette smoking. The nicotine and the tobacco contain more than 100 complex chemicals, alkaloids, and majority of them are cancer producing, carcinogenic. 90% of the people who had cancer are smokers. Of course, other factors like damage to lungs due to air pollution, all those things are there. So we pay money to get cancer. Unfortunate thing, isn't it? Whole lung has been destroyed, become brownish in color, damaged. The person is unable to breathe, take oxygen. Gradually, he dies, which can be prevented. See what a beautiful lungs we have. Like a tree, air is going in, coming out every 3 seconds. But such a wonderful lung we are spoiling due to pollution, air pollution. See, you keep it upside down, looks like a wonderful tree. This is the way 1 million, 10 lakh alveoli exchange every second oxygen and carbon dioxide. This is a plastrated cast of the passages inside the lungs. So, can we not maintain a good health with the available organs? This is another plastrated cast of the trachea, bronchial trachea. That means, imagine this is air. When you breathe in, air goes out 1 million very minute bubble-like alveoli where exchange of oxygen and carbon dioxide goes out. So we made a cast, plastration cast, so that people can be educated to stop smoking, to bring awareness about the respiratory medicine, health, and all that. Abdomen is another Pandora's box. We have more than a dozen organs. Each organ is having a very specific structure and function, very loyally doing its work, trying to correct small little things. But due to our bad food habits, we are damaging many of these organs in our body, heart to brain to every organ. In Kannada, there is a proverb, "Oota ballavaniಗೆ ರೋಗವಿಲ್ಲ," which means the person who knows a good food habit, a balanced food habit, will never get a disease. You should never get a disease. Unfortunately, due to our taste craze, we eat all this junk food, low quality food, low quality chemicals mixed up with the food, maybe water, food, roadside food, colors, low quality, non-food grade colors. All of them enter our body through our food and water. When they are dangerous chemicals, some of them are cancer producing also. They go around the whole body through the blood. So different organs are all affected to these chemical poisons. So here is a nice photograph, a diagram rather. On your left side and diagram's right side, you can see a purple colored one, violet colored one. There's a liver, a wonderful factory for processing all the food that we have consumed. Below that, there's a small balloon-like structure called the gallbladder. That is the one which stores bile necessary for digestion of some of the fatty complex substances. And there's the one which can hold some stones, gallstones, what we call. Incidentally, you can see a gallstone, real gallstone operated last month. So these stones form, we get the pain, and you go to the hospital. The doctors or surgeons examine, they say you got a gallstone. They get some investigation like an X-ray or ultrasound. There are many stones, different colors. There's a white one, greenish one, blackish one. They say it has to be operated. Nothing can be done. Small ones would have passed off. The large ones get stuck up. And gallbladder probably also is damaged, infected. So gallbladder operation, many of you heard about it. On the right side is the stomach opened up. One of the most important organs is a bag for storing the food that we consume immediately, starting the digestion. Interesting fact is, stomach produces a juice called gastric juice, which contains hydrochloric acid, very strong acid, hydrochloric acid, which can kill all the bacteria, viruses, fungus, everything. If hydrochloric acid was not there, probably we would have got diseases every day, every minute. So trying to sterilize the food, break down all the living cells, including vegetables and other things, and kill all the bacteria, viruses, even worms. Below that, you're seeing a small strip of yellowish organ called pancreas. We'll be seeing them again. There's again a gland which produces juice, which helps in digestion of carbohydrates, there is sugars and starches, fats, proteins, everything. Below that, you are seeing a little bluish colored one, both on the left side, right side also. That's called this large intestine, where the waste material, after utilizing and absorbing whatever we need, the extra waste material is stored in this to be passed out to the toilet, maybe next time, next morning. So this is the storing the biochemical waste materials which are not needed by our body. That rose-colored or cream-colored long tube is a small intestine. Yes, this is the most important. 20 to 25 feet long, very interesting. So this long intestine, actually diameter is small, that's why it's called small intestine, helps in digestion of all types of food substances. It may be breakfast, lunch and dinner, vegetarian, non-vegetarian, liquid, solids, whatever. All that is digested because stomach gastric juice, bile from the liver, pancreatic juice, its own juice also, intestinal juices, help in digestion, breaking down of the food and absorbing into the blood, supplying all the energy to different parts of the body. So abdomen has got so many organs, kidneys are there, they are not visible here. Yes, you can see the kidney on the back below the liver. They are the housekeeping force, 24 hours a day. The blood flows through them, whatever is not needed, urea, uric acid, excessive amount of sugars, sulfates, phosphate, creatine, so many chemicals, the drugs that we have consumed, maybe the poison that would have gone into our body, all that is filtered, made into urine and passed out. So brownish colored one, which look like a bean shape below the liver. The yellow colored one is a ureter, which carries the urine from the kidneys. And the lower end has got a rose colored one, that's urinary bladder, which temporarily stores the urine till it is voided. So this is a single kidney. On the top of the kidney, there's a head called adrenal gland. It's the endocrine gland producing hormones, which are going to maintain our blood pressure normally, going to help in maintenance of my blood sugar level, carbohydrate level, helps in the stress and strain activities to be controlled. So very important organ, adrenal gland. Stomach, as I told you, is a bag, temporarily stores the food that we consume immediately. This is a plastrated specimen. This is the shape and size of the stomach. It can hold 1 kg, 1.5 kgs, depending upon the age and food habits. Liver, as I told you, is a wonderful kitchen. 100 kitchens in one place, under one roof, I always tell. Whatever food you have taken, carbohydrates, fats, proteins, minerals, vitamins, solid, liquid, all that is absorbed into the blood from the intestine, stomach, then passed on to the liver. In the liver, whatever is taken, raw materials needed, new proteins are produced, new blood formation materials are produced, repair work is done, toxic or poisonous substances are all filtered or altered. So wonderful organ. But unfortunate thing is viruses can affect this liver, hepatitis virus. Still more unfortunate, our own bad habits, dirty habits, alcohol. Every drop of alcohol can damage and kill thousands of liver cells. They're the kitchen. We want to damage the kitchen. So over a period of time, virus infection or alcoholic hepatitis damages the liver cells. Liver starts shrinking. Only fibers are left. That's called cirrhosis. Later, the same thing continued, leads to cancer. A lot of people are dying nowadays because of cancer. Pancreas is another associated organ with the digestive system. A wonderful organ, is a double organ. One is juice produced by this pancreas to digest carbohydrates, fats, and proteins. Another more important than this is production of insulin. Insulin is necessary to control the blood sugar levels. Any change in the insulin level is going to lead to the sugar problem or what we call the diabetes. So it produces a very special hormone known as insulin. And this insulin, I got wonderful instruction. It goes to small intestine and says, we need energy, we need sugar. Please absorb the sugar, entry point. It goes around the whole body, saying that there's so much of a sugar in the blood. Please use it. Sugar is a form of energy for various biochemical activities. Do your work efficiently. Take the sugar. He's a serious administrator or supervisor. Imagine for a second, insulin production has decreased. So nobody is telling to utilize the sugar in different regions, extra accumulation of sugar in the body. The sugar cannot be so easily removed from the body also by the kidneys. So sugar also passes in the kidneys, in the urine. So whole body becomes sugary. So such a wonderful thing is keeping our body perfectly clean, free of diabetes. Another important organ for the women for procreation and continuation of the race is the uterus. Yes, this is a uterus. But I got the specimen of uterus also here. You can see the uterus inside. This is real uterus, operated and removed. You have heard hysterectomy. If you carefully observe at the tip of this, there's a reddish area. This is a real one. It's not a model or a plastic prepared by plastician technique. One of my classmates, a gynecologist, he handed over this about 35 years back for doing plastination. At the tip, I'm sure you're able to see a red area. There is a cancer of the cervix. Unfortunately, increasing nowadays. Virus infection, unclean habits, not going for a checkup with small little problems. Two cancers are very common in women. One is the breast cancer, second one is the uterus or cervix cancer. So both can be cured 100% in the beginning. I've operated a lot of women with breast tumors, including cancer. They're still alive after 25, 35 years. So never neglect, never be afraid. Go to the doctors. Any change in your body or day-to-day things. Bones are the framework, skeletal framework of our body, just like a multi-story building has got the beams and pillars. 206 bones, wonderfully arranged, different shape, different size, to give protection for locomotion, movement, protection of delicate organs, movements at the joints, so many things. No, that's not all. There's much more important thing for these bones and skeleton. This is a factory for production of blood. You'll be surprised, isn't it? Without blood is produced somewhere inside our body. But the blood is produced inside these bones, bone marrow. Those who are non-vegetarians would have seen when you break the bone, you get the red spongy material. There is a bone marrow. So without bones, no blood. Without blood, no life. So bones, even though they look like a inanimate, lifeless pieces, that's the most important thing. They produce the blood. They got so much of a calcium. We call them as a calcium bank. Calcium is such an important element for muscle contraction, heart working, brain working. Any slightest shortage of calcium, bank is there, calcium bank. Immediately the bone releases calcium, compensates for the loss. Unfortunately, due to fast life, fast traffic, people meet with accident. You can see, make out, there's a fracture of the thigh bone. They have to be bedridden. It's repairable, it's not a big thing. But the person will be bedridden for 6 weeks, 8 weeks. But a loss of his day-to-day work, student or staff. So one should be careful, a little careful while traveling in the different regions. Fast traffic, overspeeding can cause all these things. Muscles are the power of our body, just like our engine in a car. There are more than 550 to 600 muscles in the body. Very powerful, very active. They provide movement, they provide pumping. Heart itself is a muscle. The different muscles in the different organs, they all provide movements. Bones are attached with muscles, they do so much of a movement. So take care of the muscle, it'll make you healthy and happy. No question of any pain, no question of any exhaustion or any problem. Eye is one of the most important thing, probably, because we are able to see something. Imagine a person blind since birth, visually impaired. He cannot see any light. He does not identify anything. But our eyes, luckily for us, wonderful. Take care of the eyes. Be careful. So this is a cataract, maybe normal. Old age, 45, 50 years, become cloudy. The cataract surgery has become so simple and hardly 10 minutes. They take out this opaque cataract lens, put a synthetic one. Wonderfully, it works for 50 years more. So it's a plastic lens. In fact, I always say it's much more clearer than the natural one. As age advances, some patches will be like clouds, but a synthetic one, plastic one is excellent. Person gets a full normal vision. This is a baby which I feel very bad. This I had operated about 43 or 44 years back when I was working in the children's surgery department. Villagers, this by about 3.5 years, I think, 3.5 to 3.4 years from a village. Another younger child, hardly about 6 or 7 months old child, girl child was there. Couple typical village farmers. They brought to our department saying that there's some, they thought it's cataract. Who borough? To be operated, the baby is going to become, boy is going to become all right. When I examined, I knew what was the problem. It was so difficult for me to convince and explain to the parents, uneducated, they cannot understand, they cannot accept, they cannot agree. So, Mother surgery, convincing was a bigger task for us. It took 3 days nearly to explain that that particular eye does not have any side. I demonstrated asking the boy to close one eye and say what is visible. When the normal eye, left eye was closed, he said nothing is there, total darkness. So I had to explain to them it's not cataract, lens is not there, it's not the lens that has become opaque, it's a big tumor, cancer. Retinoblastoma is a cancer of the eye, which started before the birth of the baby. So they cried and took 2 days to finally say yes. I told them if you do not get operated now, other eye also will get spread of cancer cells. From these two eyes, the brain is going to get cancer cells. So please understand and decide. When they agreed and we operated on this right eye, removed the whole thing, leaving nothing at all inside. An artificial eyeball was put. Baby came for a follow-up every month. After 4 or 5 months, as you can expect, they didn't turn up. Probably the child should be all right. So cancer can be there at birth also. The front of the eyeball is like a glass, watch glass. There's a damage and opacity from a dead person, not from a living. We take out the two corneas. I do it after death. They inform me. Go to their house, take out the cornea or the whole eyeball. Transplant it to a person who has got a corneal blindness. He gets a good sight. Ear is another delicate organ. One should be careful not to put any hard or harsh things inside the ear. They're delicate, very, very small little things. So, loss of hearing can understand how socially it is difficult. Students unable to hear what the teacher is teaching. Teacher unable to communicate with children or colleagues. Lecture going on, music is going on, unable to hear. So embarrassing, social embarrassment. So very delicate organ. The bones inside, in the middle, as you can see, are very smallest bones, very delicate. High intensity sounds sitting in the front row where 1,000 watts speakers in a orchestra dance are putting on the headphones. High intensity music. Nowadays the youth put on the music while driving scooter, car. They enjoy. Their mind is diverted. They meet with accidents. High intensity sounds for a long time can also damage the nerves. They become deaf. Nothing can be done. Very complex surgery for the inner ear. Cochlear implants, very expensive. So take care of the eye and ear. They are needed for communication. You can see that these are these three small bones on the left side, white colored one, which are only few millimeters. In the photograph, it looks very big. It's only few millimeters in size. The red area is again a plasticated one, where sound is converted into electrical signals, balance is converted into electrical signals. So ear is meant for both sound, hearing, and balance. So in a problem here, the person will have giddiness, loses balance, hearing problem can be there. So very delicate organs. So we also harvested bone from the dead person. We implanted it, transplanted into a person having bones. It worked. So we applied for the grant, DBT grant. Obesity is the biggest problem now, both childhood and adult obesity. See the person, I always tell him, we don't look into his hand. Difficult to say which is the front end, which is the back end. Very unfortunate. People go on eating and eating and sit and eat and sit. They don't bother about overweight and obesity. Unfortunate thing is, obesity is a big invitation to all the other diseases, starting from high blood pressure, diabetes, joint problems, kidney problems, heart problems, brain problems, you name it. Women in no way inferior to men. Every year we bring awareness programs. Just eat what is necessary. Why you want to have storage of fat in your body by excessive eating. Your children obesity, 20% of the children are more than overweight and obese. The whole world is now bothered about overweight, obesity, cancer, diabetes. Maybe the boy may not be more than 5 to 6 years old, but definitely his weight would have crossed 50 kgs. Bima. So teach the children about food habits, junk food, outside food. This is what happens. Come to McDonald's, go on eating, watching TV or some program. How much they have eaten, they are unable to understand. Hormone problems are increasing nowadays due to contaminated water, contaminated wood, nearly a dozen hormones, pituitary gland, thyroid gland, adrenal gland, testes, ovary, pancreas, so many glands are there. You're seeing a lot of patients with hormonal problems, men, women, children, any age. So quite a complex thing to diagnose. They come late also, there is a problem. So different investigations have to be done. The poor, very difficult to manage them also. So hormone therapies, hormone-related issues, including cancers. So one should be aware of the normal. See this thyroid lady, such a huge thyroid and whole neck is swollen. I don't know why she was just keeping it for such a long time. We do not know. It may be non-cancerous thyroid adenoma, or it may turn out to be cancer also. So we tell them, come to the doctors, visit the doctor, don't neglect, don't delay. See this lady, the thyroid tumor is bigger than her head. Very unfortunate, isn't it? Negligence. This is not a girl, this is a boy. More than 2 dozen operations have done under local anesthesia. The boy is not supposed to get a breast, but unfortunately, due to so many reasons, including some hormone changes, the boy has got a breast development. Socially, it is a problem. The boys at the age of 10 years, 12 years, 6 years, they hesitate, they feel shy to tell. Somehow the mother comes to know, then she brings her to the hospital. The problem is it's not the breast. The tumor inside the breast, what we call is gynecomastia. Gynecomastia means mastia means breast. Women's breast is supposed to be in women only, not in men. So such a breast development in the male is very dangerous, and many times it can become cancerous. So as soon as you see them, explain to the youth or a boy, 20, 25 years operated. As early as 5 to 6 years I've operated. Tell them it's not a nice thing. Do not neglect. If you simple blood test and scanning is going to help me in a surgery. Under local anesthesia, I operate both of them, they're fine. So early diagnosis, boldness in decisions is going to help us. As I told you, pancreas, wonderful organ for controlling the diabetes. Teamwork is necessary. Any profession, anything, alone is not possible. A team, like-minded people, good people, people with a positive attitude, people having the social commitments, not really bothered about making money or this thing, and greedy people. I'm sure there are a lot of people. Make a team of them. Together, each one contributes such use more. So I have a team of people somewhere there in the middle corner. I'm standing there. These are about 20 years back, not a recent one. And majority of the little elderly looking persons, like a person in the on your right side with a black shirt, next person white shirt, next person with a bouquet, person with in shirt, person with a tie. All of them are my colleagues, doctors. And a few in between, they're all, the lady also is a senior scientist. And in between, you can see youngsters. This was 20 years back. Now they're all late 40s. There are PhD students, scholars. All of them have completed PhD, but in neuroscience, very hardcore brain research, depressions, related diseases. They're all abroad, postdoc. They are very well settled. Even today morning, one of them called me and said, "How are you, sir?" So there are wonderful things. We need a team of good people, like-minded people. A few words about my plastination lastly. This is like similar to mummification of Egypt, but dry preservation. I prepared this mummy. It's a 9 months old dead baby in my museum. It was prepared as a mummy because children were curious how the mummy looks like. It's an art, not only science, it's art of dry preservation. Some curiosity, some creativity, some out of way, sometimes madness creates all these funny things. Incidentally, I'm the only person in India trying for 10 years, 15 years to do this plastination. New technique of preservation of biological species, not only human organs. You can preserve plants, animals, anything. Scriptures, Tadegari, anything. They are dry, no smell, almost original colored, portable, you can carry in your bag, non-irritating, and most important, inexpensive. First person is Gunther van Hagens from Germany. He did it in 78, 79. Very expensive, very, very expensive, 30, 40 times more expensive. Second is me. We are from a poor country, poor family also. So using locally available chemicals, I designed this. In the international conference, I got the best paper award also in Australia. So do something very honestly, you'll be recognized. Because of this, I established a plastation museum in my college. That's the only one in India. No bottles there. All the specimens are outside, no smell. People can touch and feel the real organs. In fact, I've prepared some snakes and scorpions also, some plants. Even the visually impaired people, otherwise able people, also can touch it. We have prepared a periscript also. They're so happy to touch the heart, the lungs, the baby's skeleton, bones, tumors. So once in a while, we get the visually impaired children, including teachers. So the heart, which I showed you, another heart, plastinated heart. This I shown you the tracheobronchial cast. And the plants can be plastinated. Botany people can use this technique, very cheap, few tens of rupees or so. So in the international conference, I got the best paper award also at Brisbane, Australia. After coming back, UGC-CEC recorded a video program for teachers. We got the national award also in 1999, both in English and translated to Kannada. Both UGC programs, we got a national award, art of immortalizing. So these are some of the specimens. The one on the left side top is a ovarian cyst. Normally, ovary is almond shaped, become a tumor. You would have read in the papers, the lady was operated, 10 kg tumor, 40 kg tumor was removed. Yes, there's it. Small plants can be plastinated. Inside the brain, there is a space on the right side bottom. Silicone cast of the thing, we use it for research purposes. So when we do something out of way, we get recognized. So I had the privilege of appearing on the cover page. And a very popular Kannada weekly called Taranga. The happy and proud thing was 134,000 copies were printed. Many times, many prints. What more you need in your life? 134,000 people, maybe double, because we always read somebody else's book. Sometimes we don't even return the book also. So more than 3 lakh people, publicity, no? So I always tell my students, do something out of way, you'll be recognized, you'll be happy. So the plastinated people, just for the sake of fun, skin removed, muscles. The animals can be plastinated, scorpions, snakes, cobras, everything will be plastinated, the tumors. Some creativity lastly, to keep yourself happy, maybe to motivate others. These are my colleagues. Wife is a neurologist. You can see the right hand with brain tattoo. Husband is a cardiac surgeon. The heart is of a Kamala, flowers and all that. A nice ideas, isn't it? So children have hobbies, encourage them to develop hobbies that puts in a lot of positivity, their success. Happiness stops when start comparing. Why to compare? Compare myself. Compared to yesterday, I should be better than yesterday. So people, boy doesn't have a hand, the other boy doesn't have a leg. See how they happy. We have everything, still we are unhappy. Very unfortunate, isn't it? So my hobbies include music. No, of course, no question of stress or something. For change from my profession, sing a song, take up a mandolin, guitar, harmonica, play old classics, old film hits, feel happy. Friends come. Arts and crafts is my hobby. Electricity, electronics, surprising. Being a doctor, some poking those into engineering field. I have designed a lot of low-cost equipment for my medical profession. When you come home without appointment, you'll be surprised who is the doctor in the house because I'll be with carpentry and other things. You'll ask me only, is the doctor available at home? Because that is my funny attire, my house, writing articles in different languages. Cooking is my passion, I do cooking. In final year, I made these doors myself and I got the first prize. So some things. I get involved in cookery, not as a competitor, just to encourage students. I do all these things. When you come to Mysore, please call on me. You can come home and wear all these things for you. We'll be happy. We'll share this. I do all these things. I have learned from my mother. All this. I didn't spend any money for educating in the high school or college, PUC, BSc also I did before MBBS, MS, because I had the privilege of getting Government of India National Merit Scholarship. So without spending money, I became a doctor. I thought there's a social commitment. My father's name, my father was Munna Krishna, was a veterinary doctor because I was afraid of animals. I became a human doctor. In his name, since about 29 years or 30th year, I think, we are giving a gold medal to a student who scores the highest marks in my subject of anatomy. Some encouragement. So I've traveled a few places. There's something big about it. Behind every successful man, there's a woman. There's a proverb. This is my mother. 2010, she expired at the age of 93. Very active. You can see the smiling face. We donated her body. Her body has been plastinated even after 15 years. I can still see my mother's body. No cremations, no burning, no grave. So I can understand how enthusiastic she is. Thank you for patient hearing. I think I'm in time. If you have a few questions, I'd be too glad to answer. So be happy, make people happy, have a nice, wonderful health. And my logic is Sarve Janaha Sukhino Bhavat. Keep yourself happy. Try to keep the whole world happy also. In case you need any of my support as a good friend, you can always call on me. I'll be available. Both the mobile numbers will be on, except when